the first author on this and did a tremendous amount of work. She works with me, wasn't able to be here due to illness, but I'm pinch hitting for her, okay? These are the disclosures. Only our collaborator, Caroline Mitchell, in the OBGYN department has some disclosures. A little bit of information about bacterial vaginosis. It is a common infection of the female reproductive tract. It's believed to involve dysbiosis or derangement of the normal bacterial flora, resulting in significant symptoms like itch and pain and possible sequelae. 30% of women in the US are impacted by this, and worldwide the estimated cost of the disease and its sequelae annually is $13 billion. As I mentioned before, there are some clinical complications down the road that can happen, such as pregnancy complications. There's an increased risk of sexually transmitted infections in people who already have bacterial vaginosis. The bacteria can migrate to the higher up the genital tract and in the urinary tract as well. Standard treatment is metronidazole and clindamycin, which are very cheap, very common antibiotics. We wouldn't be pursuing this disease if they worked really well. The problem is that despite treatment, there is no microbiological cure in 20%, meaning people never clear. And even when they do clear, they recur. As a result of this, the normal vaginal flora cannot be reestablished, and therefore you have a $13 billion problem. So we approach this via antimicrobial blue light in vitro, using a number of the common pathogens that are associated with bacterial vaginosis. I won't get into the mechanism of blue light right now just for lack of time, but I believe also my colleague Carol just discussed it. These are the strains of bacteria that we focused on. So Lactobacillus crispatus is considered sort of the predominant normal bacterium in the vaginal flora. These other ones are all considered pathogenic. Lactobacillus inners, Gardnerella vaginalis, Fanny-Hessiae vaginae, this used to have a different name, and Prevotella bivia. We grew them, we cultured them in an anaerobic chamber because they do prefer anaerobic conditions. We inoculated them at a constant optical density to control the number of organisms that we were treating. And then we irradiated them with 405 nanometer blue light at an irradiance of 60 milliwatts per centimeter squared. We conducted 3 independent replicates of each of the strains that we did. And then we calculated the kill curves, or how effective we were at killing the various bacteria, as a function of radiant exposure by counting the colony-forming units. This is a summary slide, and what we see is admittedly a little bit surprising to me, but we can probably explain it, but also very good news, that the antimicrobial blue light seems to be selective for the bacteria that we don't like, and more preserving of the bacteria that we do like. And that is, this is the log kill versus radiant exposure in joules per square centimeter. And Lactobacillus crispatus is the top one, the one that takes the most radiant exposure to kill. All of these other common pathogens are less. This one is one subset of Gardnerella vaginalis, which is pathogenic, and is statistically significantly different, although it does take a little bit longer to kill that one in vitro. And I just want to go through here the pair-by-pair comparison to convince you that we do have some statistically significant results. So in comparing Lactobacillus crispatus with this particular strain of Gardnerella vaginalis, we see that by the time you reach a radiant exposure of 62.4 joules per square centimeter, you have significant difference between the kill of crispatus and this organism. This isn't to say that you necessarily need a negative 8 log kill, but that you can achieve it. Similarly with this other strain of Gardnerella vaginalis, third strain of Gardnerella vaginalis, Prevotella bivia, F. vaginae, Lactobacillus inners. And so we're very encouraged by these data because we show that this number here, 104 joules per square centimeter, is the maximum statistically significant fluence that we were able to show that we could kill all the bad guys and relatively spare the good guys. I don't think you actually need that total fluence in a single treatment in order to properly reorient the vaginal flora. I don't think it needs to be that high. But this is the first disclosure or publication of data regarding these organisms that are frequently implicated in bacterial vaginosis, suggesting some selective activity for antimicrobial blue light. All right, thank you very much.